All right, so this is a kind of a long title. I didn't have time to think about a shorter title, and so I went with one that's pretty descriptive. I'm really interested in the issue as to whether life satisfaction, particularly, can act as a buffer to the kind of structural conditions of life. This work emerges out of our long-term interest in the status and process of life for the African American population, and it deals with the question with regard to how can we understand resilience in a population like African Americans in this particular society. And so I started fooling around with this about 20 years ago. I'm now going to get back to it. This conference gives me an opportunity to do that. This won't be my best talk on this particular topic because this is my first return to it, but subsequent talks actually on this topic will get better because I'm committed to looking at that. And I hope you agree with me by the end of the talk that indeed there may be something of real interest here in this kind of work. So here are some assumptions. I assume that bad chronic psychological states and negative structural circumstances of life produce negative emotional states. For example, dysthymia. Some of you don't know this, but African Americans actually have lower prevalence almost every major serious psychiatric disorder except dysthymia. Dysthymia is chronic low mood, and African Americans suffer for that at higher rates. And one can understand that given their structural conditions of life. I don't test that directly in the talk today, but I think this is indeed which is going to carry the effects that I'm going to talk about. The second thing is, think about my interest is the issue of emotional climate. And while momentary sampling and other ways in which I know are very exciting for people at this point, can be viewed as assessments, in my estimation, of emotional weather. But emotional weather occurs within climate, particularly for issues that have to do with things like poverty, low income, other kinds of issues which are long-term, sustained, chronic, over long periods of time. Homeostatic adjustments are necessary in maintaining positive climate quality of life. I note Cummins' work from about 1995 to 2007 in Australia, if I remember right, had done some very interesting work on this issue with regard to homeostatic processes with regard to well-being indices. So the proposition that I put before you is that people may use homeostatic adjustments in life satisfaction to blunt the negative emotional consequences of life on a range of social, psychological, health, and structural conditions of life over relatively long periods of time. This is the proposition which I'm going to be looking at today and trying to test. And secondly, do positive changes, which is a specific question I'm interested in, over time, in life satisfaction, offset the negative changes in structural life conditions, such as perceived financial status and poverty, which I'm going to show you today, on contemporary social, psychological, and health assessments in populations? That's the question which I'm interested in. Let me be clear, and I want to be real clear about this, because there's some of the people in the room who really have done really the nice work in this particular area. I am not discussing issues related to the maintenance of homeostatic balance and subjective well-being, which has been the focus of lots of work. Diener, Lucas, Schwartz, this has been the question which they're interested in. I'm not really interested in that question. Instead, do people use life satisfaction, for example, as a mechanism to offset the negative emotions that ensue from negative structural changes in their lives over relatively extended periods of time? And that's what I'm going to be testing today in the data that I'm going to share with you. So the outcomes of interest today, and I'll quickly run through some of these, are self-esteem, happiness, psychological distress, perceived poor health, and health disability. So if I'm going to talk about all that, it's going to have to go quick, right? So, we're going to be moving here at warp speed at some particular point. Someone said yesterday, talk really fast. Maybe that was Brianna, I don't know, in her talk that she gave. But, so do I, so we'll see. So this is the period of time in which the data I'll be using just to give you a sense of what the circumstances are. I know that yellow is hard to figure out. I had a hard time trying to change the color. But over this period of time, median income between blacks and whites maintains a steady, large differences. And this hasn't changed since 94 to 2015, this particular set of circumstances, even though the time period when I'm testing this is between 80 and about 97 or so. So I just give you an idea. If you look at the percent below poverty, and you break this up into young blacks, older blacks, and whites, the most interesting thing about this particular slide is whites of all ages are less likely to be in poverty of blacks of all ages. So that poverty is more a systemic aspect of life for the African American population in the United States during this particular period. And by the way, that hasn't changed either. Changes in family income, again, just to make the point, this is 91 constant dollars, and this is in the National Panel Survey of Black Americans, but it just shows you that over this particular period of time, things didn't get much better. These are constant dollars. If we look at the changes in poverty, and one of the interesting things about the poverty numbers is that you see things didn't get better either over that particular period. And what's important here is the PSID finding is that for any particular given population group that you look at, while the proportion in poverty doesn't change, the actual people who are in poverty changes over that particular period. And that becomes an important issue that I want to look at because I'm interested in changes in poverty, changes in income, and other kinds of issues, and what role life satisfaction plays. This is the means of life satisfaction, happiness, psychological distress, health, disability over this same period of time. And I just show you this to see that they're not really severe changes. The health disability changes could indeed be due to changes in the population, particularly deaths among African Americans in that particular period as to why you get that effect. But these are not out of the range over the time which we're going to be looking at. All right, the data I'm going to share with you today is the National Panel Survey of Black Americans. A lot of people don't even know that this panel survey exists. From 1979 to 1992, over the 13-year period, we collected panel data on a national sample of African Americans. And of course, I think people are more familiar with the American Changing Lives study, which is actually still ongoing. And this is the period where I'm looking at that to kind of correspond to the National Panel Survey period of time. This just gives you some idea about the panel quality. We started off with about 2,000 people in 1979, and wound up with about a total sample of 630 or so by 1992. These are the sampling outcomes. You're just going to trust me on this. You know what I mean? Because if I take time to, yeah, okay. So trust me on that. This is what the sample looked like. What we're going to, analysis are on the panels. This just gives you some idea about the sample quality over that particular period. Some of the measures that we're going to be looking at include psychological distress, measured kind of in the usual way. This is before the K6 measure. Otherwise, we possibly could use that anyway. I could go back and do that. I haven't done it for this. Happiness, which is the traditional ISR measure, all things considered, you know, people at ISR know that by heart. The disability is a modified activities of daily living assessment in terms of disability measure. Self-esteem is a 10-item modified Rosenberg measure of self-esteem. And poor health, how would you rate your health at the present time, was a measure that we use for that. The changes in life satisfaction were measured simply. This is a relatively simple analysis, particularly in comparison to some of the analysis possibilities we heard yesterday. This is really simple. The most complicated it gets is regressions. But the changes in life satisfaction were measured wave 4 or 3, depending upon the data set, compared to wave 1. Was there a decrease in life satisfaction? Did it stay the same? or did it increase? That's the measure. The changes in financial status are about the same. Are you about the same, worse off now than you were at wave one? ACL, how difficult it is to meet the monthly payments, and whether it's worse, no change, or better. The income to needs ratio, for those of you who know this work, is a poverty measure. That's a relatively hard measure. It's not about people's perceptions. It has to do with regard to the income, the number of people in their household, and issues with regard to what the number of people and how they can meet the needs of those people in the household. And then it's put on an income to needs ratio. And so you wind up with 100% above poverty, 100% below poverty, and so on. And so you get this kind of nice continuous measure in terms of income to needs. This will become important later. So these are correlations that no one would write home to their mother about. And these are the correlations of life satisfaction with the income to needs and perceived financial status. The only point I want to make here is that when I build the interaction terms later on, that I'm not actually putting things together that should not go together as independent variables. But these correlations are very small. And in fact, at the top to income to needs, you can see there's only one significant correlation, and that correlation was 0.107. And the same thing is true with regard to financial status. If we look at the correlations of life satisfaction with income to needs and perceived financial status, you get the same thing pretty much in the Americans Changing Lives, which I thought then gave me the right to treat these as independent variables and to build the interaction terms that we're going to test. The regressions that I'm going to show you are adjusted for age, gender, education, marital status, region, all the wave one independent factors, and we're looking at the wave one outcomes. So we've controlled wave one outcomes as well as all the wave one independent factors. The focus is on the interaction among the changes in structural conditions by changes in life satisfaction on the outcomes that I mentioned before. Happiness, psychological distress, self-esteem, and so on. Is that straightforward? Okay, so let me run through some of these. So this is the graphic representation of the interaction. And I'm focusing today on what happens to those individuals whose structural conditions of life actually get worse. That's the red line. So these are people in the National Survey of the Black Panel Study whose conditions, perceived financial status, worsen over the 13-year period. And we're looking at then whether their life satisfaction decreased, stayed the same, or increased. So that's the interaction which is represented in this particular figure. And what you're going to see is a very interesting effect. For those people for whom their situations worsen, but their life satisfaction increased, they are happier than those people for whom it stayed the same or it decreased. In fact, they're even happier than some of the people who are in other cells. Now I could look at all of that. I'm going to focus on that particular cell in terms of talking about the effect. If we look at self-esteem, we indeed get the same effect. That is, if life satisfaction increased over this particular period of time, even though your perceived financial status worsened, you are better off in terms of your own individual self-esteem. If health disability, which is in some ways a kind of a harder measure, I was actually surprised by this particular effect, but what we're showing is that if your financial circumstances got worse over time, but your life satisfaction increased, you can see that indeed you're actually better off than if your life satisfaction either decreased or stayed the same. If we look at psychological distress, we get exactly the same effect. You have reduced psychological distress under conditions of worsening financial situations, but if your life satisfaction increased, you're actually better off. If we look at poor health even, This is perceptions of health. What happens in this particular case? Again, it's the same effect as I showed you before. If indeed your life satisfaction increased over this particular period, it buffers the negative impact on poor health. And if you don't like that, so you say to me that you're looking at, different kinds of apples here because it's the perception of what circumstances are. Let's take incomes to needs ratio. That has nothing to do with perceptions. These are actual changes in people's poverty status from time 1 to time 2 over a 13-year period. And this shows you the same effect. If indeed your poverty status worsened over time, but your life satisfaction went up, you're actually happier. She says, I have 1 minute. So I'm gonna go to light speed now. And even something like self-esteem, you get the same effect with regard to income to needs ratio. The same thing happens with regard to health disability. I'm just gonna run through these very quickly. The same thing happens with psychological distress. And the same thing happens with poor health. These effects are consistent and constant. Are there race and age differences? That came up yesterday. We did within the ACL because we had both blacks and whites in a variety of different age groups. And what all these things will show you is the effects are more pronounced for African Americans than they are for whites, but the effects are in absolutely the same direction for both blacks and whites. The age effects are really quite interesting. So across all the age groups, you actually get the same effect. It's just more pronounced for older people, particularly for older blacks. Again, that's consistent with our prediction. This is a group which is suffering from these particular circumstances, even more so than whites, and indeed would expect then life satisfaction or the increases to buffer it even better. But this is the bad part of my talk. The rest of that is really kind of interesting as a starting point. But what predicts changes in life satisfaction over time? You can't leave without asking that question. If they're independent factors, then there must be an equation that we can find that would predict life satisfaction changes. I'm smiling because there's no equation I could find. Maybe Rich can find it, I don't know. But the fact is, doing a set of regressions on the change in life satisfaction over time for all the studies, again, there's nothing here to write home about. The proportion of variance that we account for in that change is pitiful. It's the only way in which I can look at that. And the effects, when there's some there, are actually very small. We account for a total of 7.8% in the change in terms of these independent ways of looking at things. And if you look particularly at the bottom, coping resources, these are the usual suspects that you might think would have an effect with regard to people's life satisfaction. So we're a little surprised by that. If we look at the ACL, it's even worse. It's even worse. We don't account for anything. Total of 1.6% of the variation, these regressions aren't even significant. So I don't know what the answer is to that, but I can tell you right now, I'm searching for it. So to conclude, 1, positive changes in life satisfaction seem to reduce the pernicious effects of financial misfortune and poverty on a host of social, health, and psychological outcomes. This process seems to work similarly across different racial groups as well as different age groups. And finally, more work is clearly needed on what produces the changes over time in life satisfaction. Thank you.